Hi, my name is Dr. Lakiea Wright. I'm a board certified allergist and an associate physician at Brigham and Women's Hospital. Today, I'll present a case of pet allergies. So, dog and cat allergies affect about 10 to 20% of the world population. 48 million Americans are sensitized to cat and or dog. So today we have a case here of a 17-year-old who has worsening asthma for about 3 months. So he has cough, shortness, breath, or wheeze, and these symptoms are occurring despite him taking inhaled corticosteroid LABA on about, twice a week or so, 2 to 3 times a week. In addition, he has new onset rhinitis. So no additional past medical history besides a history of mild persistent asthma, and that's now worsening, and medications, no other medications in addition to his inhaled corticosteroid except for albuterol as needed, which he's taking about 2 to 3 times a week when he has the symptoms. And so when we go over his environmental history, he notes that he has a girlfriend of about 6 months that has both cat and dog. And so that's the newest or most recent thing to his environmental history. When you do the physical exam, you see that he has pale boggy turbinates, nasal turbinates. He does have some lower expiratory wheeze. So you obtain specific IgE testing to further investigate you obtain testing to common environmental allergens, dust mite, mold, all the common allergens, and it comes back positive for dust mite, mold, cat, and dog. So your question is, what are the main drivers? You do have some positives here, but what are the main drivers of his symptoms, specifically the pet, since that's something that's new? So what you can do is dive a little bit deeper looking at the pet allergen components. And we have actually 4 protein families or component protein families that can trigger allergies and from pets. So you have one uteroglobulin, which is specific to cat. That's FeLD1, that's the major cat allergen. Then you have lipocalines, that's another major allergen group. And then you have albumins. These are highly cross-reactive proteins, so you can see them in many different species. And then when it comes to dog allergies, you have this category of kallikrein, which is specifically made from the prostate. So when we're talking about pet allergen proteins and the components, we really want to understand what's unique to that particular species versus what's cross-reactive. So is it a primary sensitization or is it cross-reactivity? So is it the cat, dog, or both? And when we look at our patient here, we see that he has high levels to FeLD1. So we know that cat is a major component. And then he has other levels like lipocalines, which are another major group, but these are FeLD4, CanF1, they're cross-reactive. And then he has one lipocalin, CanF2, that is, it's unique to dog, but it's also indicative that, cat and dog are playing a role. So it's more of a co-sensitization here based on looking at those proteins. So based on clinical studies, if you're allergic to 3 or more proteins, then you're likely to have more severe asthma. So our patient here is allergic to 4. So it's likely that pet allergy is a driver of this sort of worsening asthma. So you would diagnose the patient with cat and dog allergy in addition to the dust mite and the mold. And then the treatment would be place the patient on a daily antihistamine, long-acting one, and then nasal steroid, in addition to increasing that asthma medication, because now, his asthma is worsening, so you want him on a higher dose inhaled corticosteroid LABA combination. But then when you look at that FeLD1 and consider that, you want to think about how this is very specific cat allergen, major protein, so you could also consider allergen immunotherapy. That's something to help retrain the immune system. So this is how you can break down pet allergies. And so what I would really like to stress to primary care, the tips that I have for you are, 1, as usual, which I'm sure you do, obtain a detailed clinical history. But the thing is with history is that patients cannot tell you specifically everything that they're allergic to, and they're commonly allergic to 3 or more things. So that's why you want to dive in a little bit deeper, obtain that specific IgE testing, and then once you get it, dive a little deeper to look into components to see what role the pet allergen may be playing if it's positive. And then 2, you want to remediate the environment. You want to try to minimize exposure. But rehoming a pet may not be an option for everyone. So that's why you want to look at the full gamut of treatment option. So the environment, we want to take care of that as much as we can. The medication, so antihistamines, nasal steroids, you want to titrate their asthma medications. And then number 3, what I don't want you to forget is that we can try to retrain the immune system, and that's the allergen immunotherapy, which is available for both cat and dog. So that's when you would do an allergy referral so that the patient is evaluated to see if they're a candidate for allergen immunotherapy, which means the patient's being exposed to a little bit of allergen, escalating doses to retrain that immune system. So those are all the treatment options, and thank you so much.